I'm Dave Champion. The coronavirus, COVID-19, is everywhere in the news, and it's having an international impact. Yet there's so much bad information out there. Let's see if together we can't straighten that out. I have a couple areas of expertise, one of those being physiology, so I'm well positioned to share this information with you. That said, I'm not going to give you all of the information you may want. I'm going to give you all of the information you need. If I was to focus on everything you wanted to know, every little tiny question, this video would be immensely long. Also, if you find this video of value, if you get to the end and you say, wow, that was great, please do share it using your social media page so that more people can learn the truth. I think one of the most important things I want to get across to people is that science does not have all the answers concerning this particular situation. The COVID-19 variant of the coronavirus was just identified in December of 2019. In other words, science has been looking at this particular bug for 90 days. Let's start with the fundamentals of what the coronavirus COVID-19 actually is. So we need to start with the fact that coronavirus is a family of viruses. Some of those affect human health, some of them do not. The COVID-19 obviously does. COVID-19, which as I mentioned was just identified in December of 2019, is a specific virus, a specific variant within the larger family of the coronaviruses. Technically, it's a variant of the respiratory system infection-causing pathogens such as SARS. One of the reasons I chose to do this video is there is, in my view, a surprising amount of fear associated with COVID-19. By the way, I'm not going to refer to it as a coronavirus. I'm going to refer to it throughout this presentation by its more specific designation, COVID-19. So surprisingly to me, there's so much fear that I thought perhaps having some factual information would alleviate that fear. One of the odd phenomenons when people are fearful is, for instance, people who never trust the government. People who say the government simply cannot be trusted. Suddenly, when they become filled with fear, they trust everything the government has to say, which is unwise. Why have we seen governments around the world taking dramatically more steps concerning COVID-19 than other influenzas, as an example, that have a higher mortality rate? Well, that's relevant to the incubation period and transmission. We'll get into transmission in a minute, but what is the incubation period? We've all heard of that, but what exactly is it? It is the period of time from the moment you become infected until you begin to experience the very first symptom of that particular virus, whatever it happens to be. So from the moment you get infected, you don't feel anything, and boom, you suddenly feel the first symptom. That is the incubation period. The information we have from the medical professionals who are actually working with people who are confirmed cases of COVID-19 is that the incubation period appears to be between 3 to 14 days. There's been some reports of 20 days, but that's exceedingly rare. So you can imagine that from the time you get infected, sometime between 3 and 14 days, you're going to start manifesting symptoms. Medical professionals who are monitoring patients that have been confirmed to have COVID-19 give us particular information. There was a group of, as an example, 181 confirmed patients, and it was determined after watching them go through the COVID-19 duration before they no longer had it, that the average time to the first symptom was 5.1 days. Yeah, 0.1, I don't know how they figured that out. And 97.5% of everyone who was confirmed with COVID-19 has symptoms, if they're going to get them at all, has symptoms by day 11.5. And we'll get into that has symptoms at all comment in a minute. What's the important thing about the incubation period? We've talked about between 3 and 14 days, right? So the important thing for the public to know is that during the incubation period, you are 100% contagious to others. So with that 3 to 14 days, let's take the far extreme, the 14 days. That means if you don't develop the first symptom for 14 days, you don't know you're hot. You don't know you're contagious, and you're going about your business, potentially infecting others. That's the critical element concerning the incubation period. So here's the progression. I'm sure you're clear on this already. From the moment you get infected until the moment you get the first symptom, you are in the incubatory period and you are infectious. So we've talked about until the first symptom hits. Well, what are those symptoms? The most common symptoms are fever, cough, sore muscles, and later, possibly difficulty breathing, and that one is more of a warning sign than the others. Let's take a moment and paint a little broader picture so that people have a better understanding from the 35,000 foot level. So if for the people who are experiencing the full range of symptoms, they're having the fever, the cough, the achy muscles, and the respiratory difficulties, and we take that time frame, which is about, according to the 90 days of data we have, okay, I want to be very clear about that, that progression, that sequence that includes all of that, from the moment you start manifesting till the moment you feel better, the symptoms are gone, is, depending on the person, between 2 to 3 weeks. If we average 2 to 3 weeks and call it 2.5 weeks, and then we take the average incubation period based on the 181 confirmed patients we talked about earlier, and that incubation period is 5.1 days, essentially in rough numbers, from the moment you become infected until the moment it's done, on average, 3 weeks. I've mentioned that fourth symptom, respiratory distress, a couple of times, but I want to assure you that that danger sign, that is actually the point where you want to go to the hospital, not before that. It's important to understand only a small percentage of the people who come down with COVID-19 who are infected are actually going to wind up in respiratory distress. So when we talk about that fourth symptom, not everybody's going to get it. As a matter of fact, most people aren't. So what percentage is going to experience respiratory distress? We don't know. We know it's small, but we don't know exactly what it is because, again, we've only had 90 days of experience with this. Is the COVID-19 variant any more contagious than any other coronavirus or influenza-type virus? No, it's not. The real concern with the contagion aspect is that a lot of people who become infected with COVID-19 are asymptomatic. They don't have any symptoms, or they're minimally symptomatic. They don't understand that they have it. They have something like a headache. They have that one particular symptom, and they don't relate it to COVID-19, right? So they're either asymptomatic or minimally symptomatic. They don't understand they have it. So during that whole 3-week period we talked about earlier in the video, from the beginning to the end, okay, they can't see that. It's invisible to them, even though they've got the virus and the virus is going through its steps in their body. It doesn't manifest in the form of symptoms. So during that entire time, not just the incubation period, the entire time, they're out in the population infecting others because they don't understand they have it. Let's move on to how the virus is transmitted. And here, I don't want to say experts disagree. I will say experts put emphasis here or here, seemingly creating a conflict. Some experts believe the primary mechanism for transmission is face-to-face contact, you and I standing around talking. And this video would be extremely long if I got into the science of that and the dynamics of that. So I'll suffice for this video to say this. It is generally considered, with any virus that's transmitted face-to-face or has the capacity to transmit face-to-face, if you keep a 6-foot barrier between you and other people, then it is incredibly unlikely that you're going to get it from face-to-face contact. Now, that may not always be possible. For instance, let's say you're in a staff meeting at the company and you're all around a conference table. You've got somebody sitting here, somebody sitting here. Clearly, you are not going to be able to maintain that 6-foot distance. The important thing then is that people are not coughing in your face. They're not sneezing in your face. And frankly, if they're doing that at a meeting, you should ask them to leave. And if you're the boss, you should order them to go home. There is absolutely no value to having, in my opinion, to having a sick person come in and infect and create a whole bunch of other sick people. I've never understood that, COVID-19 notwithstanding. I have never understood why sick people come to work and want to make everybody else sick. So when it comes to COVID-19, absolutely do not do that. There's an estimate that the COVID-19 virus in the air, not attached to anything, just floating freely, can survive for about 3 hours. Now, I want to be very clear, that is non-conclusive. Again, 90 days, we don't have all the facts, but that's the figure that's being thrown around right now, that it can survive as it floats through the air for about 3 hours. Now, the alternative mechanism for transmission is when we touch things. Somebody who's infected touches a door handle, we come along behind them and we use the same door handle and now we get it on our hand. Are you infected because you get it on your hand? No, you're not. What causes the infection is then when you turn around and you do this. Anything up here is going to your mouth, your nose, your eyes. if you've got the COVID-19 virus on your hands and your hand comes up to your face, the odds increase exponentially that you're going to get infected. Again, because we've only known about this virus for 90 days, the numbers being thrown around for how long the virus can exist on a surface like plastic or steel, something like that, is all over the map. Some scientists claim it survives no more than 2 hours. Others claim it survives 72 hours. When it comes to touching surfaces and touching your face, we're going to talk about masks and disinfectants shortly. You remember a few moments ago we talked about the fact that there's a whole lot of people who are infected who are asymptomatic or minimally symptomatic. Because of that, the official mortality rate for COVID-19 of 2 to 3% is probably quite high in comparison to what it is in reality. The reason is the pool, they're judging on the pool that they know about, okay? So 2 to 3% of the confirmed cases are dying. When you look at all the cases where people are asymptomatic or minimally symptomatic, the government has no way to know that. So in reality, the mortality rate is considerably lower. The World Health Organization has publicly stated that 80% of the people who contract COVID-19 will have mild flu symptoms. That's their phrase, mild flu symptoms. That is the cough, the achy muscles, the headache. Okay. And of course, that 80% also includes people who are asymptomatic or very minimally symptomatic. So that means 20% can be expected to perhaps move on to the respiratory distress phase, which is where there is a real danger. So who is the 20% who may, in fact, be in some form of danger from this, including passing away? It's primarily elderly people. The interesting thing is, I think the public assumes you're elderly, so somehow you're frail and your body isn't working right, and so you are potentially more subject to getting these infections. It's not that. Okay? There are people that are 90 that are incredibly robust. Okay? What we're talking about is people whose immune systems are compromised by having other diseases, usually chronic disease in one form or another, so their immune system is in an already compromised state. Then, with their immune system compromised, they get something like COVID-19, and because they have an underlying condition, that condition goes downhill quickly when their body has to split emphasis. It's trying to fight the virus and it's trying to fight the chronic disease. That's what causes the problems, and that is oftentimes what results in death. So it's not age per se, it's the condition of people who are older. Older people, especially in Western society, older people have chronic diseases. That's the problem. Medical professionals who are working with confirmed cases of COVID-19 say that that high-risk group begins around 50, and you're definitely in it at 60. And based on what I just said, that makes perfect sense because those are the ages, 50 moving on through 60, when most people, especially in Western society, begin to get chronic disease. As I said, again, it's not age per se, it's the fact that when you get older, the way we treat ourselves in Western culture, myself excluded because I don't do that, by 50 or 60, we give ourselves, by our conduct, we give ourselves chronic diseases. And that presents a problem when we get something like COVID-19 coming around. A ray of sunshine in all this is that kids are virtually unaffected. Medical researchers that are, again, working with confirmed cases of COVID-19 tell us that people who become seriously ill and need to be hospitalized, there is not one single case worldwide of anybody 19 years or younger. Okay? And most young people under the age of 19 who are tested and come up positive for COVID-19 experience no symptoms whatsoever. What do you do if you determine that you have COVID-19? Well, simple. Treat it like you would any other flu. Stay home. Don't infect others. Hydrate. All the common flu advice. Now, the exception to that is if you begin to develop the respiratory distress. That's when you need to go get medical care. Other than that, there is nothing that can be done for you. Don't rush down to the emergency room. Don't rush down to the hospital because you realize I have achy muscles and I'm coughing and I have a headache, the 3 primary symptoms of COVID-19. Don't rush down to the hospital or the emergency room. There is absolutely nothing they can do for you. This is a virus, and antibiotics are utterly worthless against viruses. It's like the seasonal flu in the sense that once you have it, you just have to tough it out. But again, if you start experiencing respiratory distress, different story, go get medical care. Let's talk about the masks we're all seeing people suddenly wearing out in public. Okay, so first of all, the most important thing we need to say is there is zero scientific evidence that those paper masks stop anybody from getting COVID-19. There's a couple reasons for that. First of all, those masks don't actually seal. So if there's any place that air is getting in and the virus is in the air, it's getting behind the mask. Also, those paper masks do not block particles as small as the COVID-19 virus. So if air is passing through them and the virus is in the air, it goes right through the mask. Is there any benefit at all to wearing one of those paper masks? Well, there may be one kind of benefit. And that is, sure, we just talked about the fact that it doesn't prevent transmission. However, if somebody comes along, we'll use the example of the doorknob again. They use a doorknob, they're infected, and then you come, by the way, their hand is not going to be a problem on that doorknob unless they've been doing this, okay? Now the COVID is on their hand, then they reach down and they grab the door handle. You get how that works, right? So they touch the door handle, COVID-19 is on the door handle. Now you come along and you touch the door handle, now the COVID-19 virus is right here. The only potential benefit to the mask is it prevents you from touching your nose and mouth. I should also point out that one of the other infection portals, if we can call it that, is the eye. So while the mask will stop you from touching your mouth and your nose, you may still be doing this at times and you can get infected that way. So if you want to wear a mask as a reminder not to touch these two portals, that's fine. As soon as you get someplace where you can wash your hands, then you can take the mask off. I've tried not to present anything in this video that the dominant media is pounding to death, but I just mentioned hand washing, so let me talk about that for a quick second. I've seen quite a number of things on the internet about how long to wash your hands. Well, okay, it's not about the time. The reason they focus on time is if they said, here's how to wash your hands, nobody would click on that because everybody presumes they know how to wash their hands, right? Every adult knows how to wash their hands. The reason that they focus on the time is people go, what do you mean there's a time thing going on here? And all the time is when they say like you should wash your hands for at least 120 seconds, right? All they're trying to do by giving you a time frame is get you to stare down at your hands and focus. If you're focusing, you're probably going to go into every little crevice, which we don't normally do when we casually wash our hands. When we talk about the virus residing on surfaces, that immediately for a lot of people brings up the idea of disinfecting those surfaces. And that's certainly a good idea if you can identify what surfaces may have the COVID-19 virus on them. However, good luck finding any one of the roughly 75 commercially manufactured disinfectants available on the market right now that would kill COVID-19 because they're gone, the shelves are empty. So there are probably a number of home remedies for this. I'm just going to share one with you. If you make a solution that is 1 part bleach to 50 parts water, that will kill the COVID-19 virus. So if you can't get a hold of any commercially available disinfectant, you can use that. Keep in mind it is bleach, so fabrics, not so good. Hoarding. Stop it. We've gone through all of the facts. The part we're going to go to now, we're going to talk about government and government's role in this, but having discussed the disease in some detail, there's no reason for anybody to be hoarding. It's not like you're going to be out of commission for 6 months. You're not. The best thing to do is treat it just like any other form of the flu. So if you had the annual ordinary flu going around and you wouldn't go out and purchase 3 months worth of toilet paper, don't do it now. Let's talk about government's role in this situation. The first thing I want to talk about, because it affects a lot of families, is the closing of public schools. All right, now, I already mentioned that one of the bright sides to the COVID-19 virus is it seems to have no effect upon kids. And that's important to understand that when they're doing the school closures, it's not for the kids because the kids can get infected. They're asymptomatic. They don't even know. The reason that various states or regions within states have closed public schools is to protect the parents. Why have we been behind the curve in testing people here in the United States? Well, there's a couple of reasons for that. As one health expert who deals with contagious diseases commented, our country, our system, isn't set up for this. Perhaps it should be, but the reality is it isn't, or at least it hasn't been. Perhaps it will be moving forward, but as we're facing this COVID-19 situation, according to the experts, our country was not set up to perform this kind of testing. We didn't look ahead to this kind of eventuality. The other reason, which is completely asinine, is the CDC decided that the test that the entire rest of the planet is using to determine if you've been infected with COVID-19, the CDC decided we weren't going to use that in this country. So the CDC designed their own. And when it went into production, guess what? Yeah, it bombed, it failed. So that's another reason that we're so far behind. You can thank government for that. And that's part of the thing that amazes me. When people become fearful, I had some woman defending that the CDC is always a credible source. Well, it's not always a credible source. And in this case, it did something that was completely boneheaded and put the entire country behind the curve on testing. So what authority does the federal government have in this? Well, very little. I've actually looked up the statute and then looked up all the regs that went behind the statute, and it was exactly as I anticipated. The federal government has no authority concerning contagious diseases except to control the movement of people across state lines. Okay, just like kidnapping. If you kidnap somebody and you take them a block away, the feds have no involvement in that because it has to be interstate movement across a state line with somebody that you've kidnapped. So interstate commerce has always been considered, well, since the 1930s, to be the domain of the federal government. And when you look at the statutes and you look at the regs, that's exactly where the federal government has authority. Here, for instance, they can actually have it's written right into the regs, they can actually have authority over somebody who is moving exclusively within a state if they can show the person's intention was to cross a state line. There are a lot of other requirements. For instance, for the federal government to take an active role, such as quarantining, for them to take active measures like that, the Surgeon General has to create a disease profile. He has to give it to the Secretary of Health and Human Services, who then has to sign off on it, and then have to have it published in the Federal Register. Until that happens, the federal government cannot take any more aggressive actions. Everything is sort of background support actions until that time, which has not yet been done. Now, Donald Trump on Friday declared a national emergency. That does not enlarge the jurisdiction of the federal government over this. It simply makes the federal government's response within its jurisdictional boundaries more rapid and more flexible. One of the big headlines was that the New York governor called out the National Guard concerning a quarantine area. Completely mischaracterized, and I was glad to see a lot of the media took that down very rapidly. And the reason that that was inaccurate is it gave the headline gave the impression that the National Guard was being used to enforce this quarantine. No one could leave, and that's not true. It was a voluntary quarantine. Virtually everybody was complying voluntarily. The National Guard was not called out to enforce it at all. That's really, really important for people to understand. The governor called out the National Guard to distribute food within the quarantine zone so people didn't feel compelled to leave the quarantine zone. It was a peaceful, non-forceful, it was not even an enforcement action. It was a, we're here to help you out. One of the rare times the government actually does really help. It was an opportunity to help the people self-quarantine. Perhaps one of the most important things to understand about the government's involvement in this is no one is going to come at the muzzle of a gun and lock you into your home. I think that's really, really important. I think that's leading to a lot of the hoarding too. People imagine it's because of COVID-19, we're going to turn to the Soviet Union, and if you walk out front, somebody with a gun, get the back in your house! You know, it's not going to happen, okay? So no one's going to force you to stay in your house. You're not going to find Humvees out on your street with, machine guns. None of that, none of that. It's really important to understand, none of that, okay? Just treat it like the flu. Stay home. Don't infect others. No need to do hoarding. The government isn't going to get involved at the level that a lot of people imagine. Chill. Is there a bright side, a silver lining, something we can take away from the experience of what we're going through now? I believe there is, and here's what it is. We've talked a little bit about why the transmission pattern with COVID-19 is a bit exceptional, because you've got that long incubation period. A lot of people are asymptomatic or minimally symptomatic, so they're walking around not knowing they have it. Okay, you get all that, right? With a mortality rate almost certainly under 1% for the reasons I stated earlier in the video. This is not a huge issue. The benefit to this is to wake people up, to wake the medical structure up, to wake up the government resources, to wake up the mindset of the people concerning what might happen if you had a disease like this that had the same transmission pattern, but instead of having a less than 1% mortality rate, imagine it had a 13% mortality rate, or 18 or 20, right? So we need to up our game. We need to be more prepared. And I'm hoping that what we're facing right now causes a lot of institutions to wake up and take those steps to be more prepared. Here's kind of a quirky thought. I think we can all relate to things like doorknobs. And if you're going to the gym, right, you're handling the same handles that other people are grabbing onto, and they might have COVID-19. We can all envision that. So here's kind of a quirky little thing. When you go to the store, especially grocery stores, a lot of times they have the little keypad and they want you to enter in your phone number, and it gives you various credits or points or various benefits with that retailer, right? So maybe it's not worth it right now, because unless you see the cashier take some sort of effective disinfectant and disinfect that keypad every single time after the previous customer used it, how many customers have put their fingers on those keys before you might want to let that go for right now? As I close, I want to make an overall statement about not just COVID-19, but any sort of bacterial infection or viral infection. Our bodies are the best tool to prevent them. But in order for that to happen, our immune systems have to be functioning at peak performance. That's a big problem in the US. I'm going to guess that 99.8% of the US population, their bodies are operating in glucosis, which is a term that means absolutely nothing to you unless you've read body science. And when you live in glucosis, your immune system is automatically compromised. It is not running at peak efficiency. Then, if you are operating, if you're the 99.8% of the population functioning in glucosis, and you're eating the standard American diet, your immune system is a mess. In Body Science, I explain why your body's immune system is compromised if you're functioning in glucosis, and how the standard American diet degrades further the efficiency of your immune system. I also describe how to restore your immune system to its peak performance. So what's the benefit of that? Well, I think it's obvious, right? It doesn't matter what you were facing, whether it's COVID-19 or the annual flu or some bacteriological thing that you stumble upon. The very best tool, the very best way to prevent being ill is to have your immune system functioning at peak performance. And this will tell you exactly how to restore your immune system to that peak performance. And you should get a copy of this, and you should read it, having nothing to do with COVID-19 in particular. Everybody should. It would enhance their health dramatically. In order to grab yourself a copy, simply go to drreality.news, drreality.news, click store, you'll see all the stuff. If you have found this video to be of benefit, to be informational, to be knowledgeable, to help people, please do take a moment to share it on whatever social media platforms you use so you can help your fellow citizens and indeed people around the world if you find that this video had merit. I hope it did. I hope taking my time to reach out and share this with you has been beneficial to you. Thanks for spending your time with me. Take care.